Today we are going to be palpating the spine of the scapula. So the first thing you want to do is look around and find the superior portion of the shoulder and rub your fingers around the scapula, looking for bony landmarks like the medial edge, lateral edge, superior angle, inferior angle, and the acromion. Once you're along the superior edge of the scapula, you can move laterally and feel for that acromion that lays between the back of the scapula and the humerus. Here I am just looking for that inferior angle, moving my fingers along the medial edge of the scapula and then finding that superior angle right on top. From there, you're going to want to find the acromion, which lays right on top by the humerus. And once you find that acromion and superior angle, you can form a line between the 2 points. Between those 2 points is going to be where the spine of scapula is going to be. From there, you can pinch your fingers along the sides of that spine of scapula and almost grab it with your fingers. Since it is such a very bony piece, it is easy for it to stick out. The subscapularis does lay right on top of that scapula, so you do have to push through that muscle in order to find the spine of that scapula. The spine of scapula is a very important bone on your body because it separates the spinatus and the infraspinatus, which are both rotator cuff muscles. The spine of scapula also provides an attachment point for some muscles like the trapezius, and then the deltoid attaches to the acromion, which is at the end of that spine of scapula. For clinicians, the spine of scapula helps them identify scapular winging, tilting, and rotation. It can also help a clinician determine rotator cuff injuries. Clinicians can also palpate the spine of scapula to get on the right direction to determine an injury to any of the rotator cuff muscles that might happen.